Hi, I'm Ilana Herman. I'm a speech pathologist practicing for the past 38 plus years in long-term care and short-term rehab facilities. I'm the inventor of the independent feeding tray, which was designed to give our patients independence and maintain their dignity when eating. Patients who have suffered a stroke, Parkinson's, a brain injury, and other neurological diseases, as well as orthopedic injuries, have difficulty eating with the use of one hand. The independent feeding tray will allow them to be independent when they're eating. Here is a testimonial of a patient using the independent feeding tray. So in your experience, have you seen anything like this independent feeding tray?
Well, ever since my infliction, I've been to about 2 or 3 nursing homes, and I have never seen anything like this. The idea of having something to hold a specific item in place. It's so much easier to eat from it, seeing that I don't have use of my left hand.
Show us how you do that, how you take a little bit of that ice cream.
I take it from the top, because I don't dare try to grab it from the bottom. It'd be too much for me to eat.
Right. You want to control the amount that you're putting in your mouth. How does it make you feel that I don't need to stabilize the cup for you, or you don't need a family member or one of the nursing assistants or a nurse to help you eat the ice cream?
It makes me feel more independent.
That's wonderful. And that's the whole goal and idea of the independent feeding tray.
Yeah.
We want our residents to be independent when eating and to maintain dignity when eating.
Well, this sure measures up to that.
So what do you find is the difference between using a regular tray like we have upstairs versus this independent feeding tray with the molded cup? Go ahead.
The difference is this tray here is just like eating on a table. There's no difference except from the table to the tray. But from this here to...
I just don't want your shirt to
Okay.
get, swallow.
Using the mold holds the cup in place just like a coffee cup in a car.
Exactly, just like a coffee cup in the car. What a great example. Right.
Because most people can relate to a coffee cup in the car.
Yes.
But this is a pleasure. As you can see, it's stable.
Yes.
It doesn't move.
Okay.
Now, if you were to do that with this, the same thing here.
All right, show us how you would do it there. Right. So what?
It'd be skating around. You can't hold nothing. Hold it.
And you know what? There's one more thing that I wanted to show, Mr. Mike Bike. Remember the other day we put it on the left side. So you also were working on strengthening your left side.
Yeah.
And you had to like reach over a bit.
Okay.
You had to turn a little bit more to the left to get the ice cream. So your head is turning a bit.
Yeah.
You're focusing more on your left, which is one of the skills that you're working on.
Right.
So it actually has two purposes. One, to make it easier with eating on the right side of the tray with your right hand. Still using the right hand, but you're focusing on turning your head more towards the left, strengthening your left visual.
Yeah.
Which is something that also is important to work
That
on.
was a great idea.
Thank you.